Financial considerations. This is my favorite part to listen to you talk about because I know this is totally your area of expertise. So let's sort of dive into the financial infrastructure here.
Okay. So I could talk endlessly about this topic, but I wanted to distill really four really critical points that I think are essential to any organization considering access. The first point that I want to talk about is the payment timing and the impact that it has on how your organization is financed. Because the second you choose to participate in access, you are basically taking on a big risk in terms of when the cash flow comes into your organization. And this was something that was pretty explicitly considered by Medicare. They said, hey, look, there's a lot of dry powder capital, so to speak, out there. Go and if you've got a solution, go out and find a funder that's willing to take the risk of giving you the cash you need to burn, but prove it by delivering the outcomes, and then we, Medicare, will pay you. So what that means, though, unfortunately, is that bootstrapped companies are going to have a really hard time succeeding in this model, because the way that timing of payment works is, as I mentioned, 50% of the income stream that you get is paid out on a quarterly basis. And so 3 months into things, you then get 25% of that 50%. So, which is what, 12.5% of your funding. So from a timing perspective, it's going to take significant amount of time for you to be able to realize the cash from this program, even if you do a great job, knock it out of the park, and achieve 100% success with this program. So you really are going to need to have some sort of bridge capital solution to be able to cover the period from when services are being delivered to when the outcomes are achieved. Historically, in the past, this would have been completely deadly for a digital health company, because you are billing traditional fee-for-service codes that required care management time. Care management staff is not cheap by any means, and so you needed to cover the cost of staff and on an ongoing basis, and that caused a lot of difficulties. On the flip side, because Access gives a lot of flexibility in terms of how you reach your outcomes, you aren't necessarily as beholden to that. And with the advent of artificial intelligence and using artificial intelligence to streamline certain processes that have historically been performed by individuals, you do then have the flexibility to maybe use technology to defer some of that expense. But of course, technology is developed by people or is led by people as more and more as AI gets good at coding. And so you basically still need to have that upfront investment to cover the time and resources that went into building the platform. Second very important financial consideration is risk mitigation strategy within your organization. And this means a couple of things. Number one, if you believe that you're able to hit certain outcome measures and you're kind of building your financial pro forma models around the fact that, like, look, we're gonna for 75% of our patients, we are going to deliver the outcomes that we promise we're going to deliver, you need to have strategies in place to be able to handle the risk that you don't necessarily hit those levers with those patients. And so what do I mean by that? Are you looking and going out and having kind of a custom bespoke type of insurance policy that says, look, if we don't hit the achievement thresholds that we think we're going to hit, we need to have some sort of buffer built into this so that, we recoup things? Or, if insurers aren't out there willing to insure for that type of product, how are you kind of building in from a cost of capital perspective, a discount rate that reflects the fact that you're considering the significant risk that's built into this model? Other risk mitigation strategies that you need to consider. What does malpractice risk look like for you as an access participant? Remember, you are a Part B provider, and so you are providing clinical care, and so you need to have malpractice insurance. And so what does that look like for your organization going into this? And really important, and I think one of the areas that might be underappreciated, comes in the substitute spend adjustment built into the payment model, which, as a reminder to folks here, says, look, if folks are going out and receiving care from other Medicare Part B providers that are duplicative to what you're doing, so you are getting treatment for low back pain, and they're going out and they're getting remote therapeutic monitoring services, or they're getting PT services out there, that's going to ding your ultimate final payment. And so what are you doing from an organizational standpoint to ensure that patients aren't doing that in a way that doesn't completely alienate the patient or completely upset the patient because they feel like your solution isn't delivering, so they're going out and getting help elsewhere? So these these are really important financial risk mitigation strategies that your organization needs to have in place.
On what you just said, and in a way that the patient actually knows what you're asking them, right? Like that's a challenge that a lot of my clients have is, multiple providers can't bill RPM in the same month as one another. But how do you ask that question, right? If you are talking to a patient about, say you're in the MSK track and you're talking to a patient about their low back pain, but it turns out their primary care provider is billing RPM for monitoring their hypertension or something completely unrelated, maybe in access that's okay, maybe it's not, but how would the patient even know to tell you about that? Because it seems so unrelated to what you are treating them for. And I know that's a challenge that some of my clients have had. And here there's even more risk, because if you don't know, if you don't identify it and you don't address it, you won't even necessarily know that it happened until it's already too late and you're sort of getting feedback from Medicare that's like, hey, we're going to actually ding you here because there was this substitute spend that you didn't know about.
And Kaitlyn, you teed up my next section perfectly because
Perfect.
I have very strong feelings about this. I think it's very important for Access participants to form what we refer to on the slide here as critical partner arrangements. And these are basically arrangements with organizations that are like primary care organizations that are responsible for other parts of the patient care journey, and really using those arrangements as an opportunity to say, hey, not just you're going to get access to these co-management, these $30 per quarter co-management payments, but we're going to really set processes in place to make sure that we're delivering higher satisfaction for our patients. So a win-win for both organizations. Your patients are going to be happier PCP practice because they're finally going to have a solution that's going to cure their chronic pain, and you PCP practice are going to be happy because you're partnering with an organization that's going to get you the clinical markers and data points that you need for your patients to know that by treating this back pain, you're going to help with, maybe other conditions that you're monitoring as PCP for the patient. So using these partner arrangements as an opportunity to not just nail down the finances, but even the operational processes, data sharing processes that might exist between your practices, I think it's important to look at that as an opportunity, as rather than we just need to check the box to make sure we have data sharing. I do think it's important to even consider, if you are an Access participant and it's really crucial in your solution to get PCP engagement, for example. Let's say you're managing behavioral health, and so you need to make sure that from a nutritional standpoint, your patient is on a good diet, but that's outside the purview of what you're dealing with, and your PCP is handling that. I think it's worth putting dollars on the table as an Access participant in the form of maybe a share of the 50% that's held at risk, to say, if hey, we work together and mutually are able to achieve success, we're going to give you a portion of the at-risk component of funds PCP practice, and in exchange for that, you're going to help us close some of the gaps that we as a solution may not necessarily have built. That, of course, involves dollars that are exchanging hands between partners that are in that are billing Medicare, and so you have AKS issues to overcome. But Kaitlyn and I work with value-based enterprise arrangements day in, day out. We'd be more than happy to kind of help you navigate that. But I do think putting those things in place is going to be important in order to achieve success within this model in the long run.
Yeah, and not only is that better for like the risk management side, right? It gives that sort of insight into data and helps providers truly understand like where's the patient at, what other care are they getting, what data matters here. But also it takes the burden off the patient to try to figure out what information they're supposed to be telling you, how to make sure they say it in the right way, that it's going to make sense for the behavioral health provider or whoever they're talking to. And all of that, on the other hand, you want to educate the patient, make sure they understand as much as possible, but reducing that stress of just trying to find the right information, figure out what they're supposed to be telling each provider and sharing it however they're supposed to be, I think can also just do a lot for keeping patients engaged and driving them towards success overall in these programs. Okay. Any other thoughts on the financial considerations?
The last point I'll make, and it's more of a bit of my personal opinion, is that for the non-behavioral health tracks, so cardio, kidney, metabolic, and the MSK tracks, a lot of those conditions are heavily impacted by behavioral health. And because one of
Yeah.
the features of Access is you can have a beneficiary aligned with multiple tracks and you receive separate payments for them being aligned with multiple tracks, I do think it's worth considering if you're a CKM or an MSK solution, either building or partnering with an organization that is able to handle behavioral health conditions, because you're not going to see improvement in chronic lower back pain if the patient has to engage in physical exercise, but they are fundamentally being held back by anxiety disorders or depression. It's really going to be important that you have the ability to push the needle there. If you look at a lot of clinical studies, you'll see there's a significant correlation between failure to demonstrate clinical improvements, MSK, for example, for among patients that have behavioral health conditions. So I do think from a financial perspective, that's an avenue that those organizations should consider.
Yeah, and if you're in the BHI space, the behavioral health integration space, or the psychiatric collaborative care model, and you've been asking for a long time, well, if the psychiatrist or the PCP is the only one that gets reimbursed for this, how do we incentivize LCSWs and behavioral health providers to participate? Now, maybe there's a world in which the behavioral health practice is a access participant and they're doing the behavioral health track. You're the endocrinologist on the CKM track, and you all are working together, and you're actually both getting financial incentives to achieve outcomes in your individual tracks, and sharing information and sort of working together in a more comprehensive way. I like that a lot as an opportunity, actually.
Thank you for joining us and exploring the details of the Access model. We invite you to watch our other videos on the basics and paths to success in the Access model. We welcome outreach if you have any questions.